Reflexive response rehabilitation. Chiropractic rehabilitation for adolescent idiopathic scoliosis. End of growth and skeletal maturity results. By Morningstar and colleagues, 2017. This study looked at whether a special chiropractic exercise program could help teens with a curved spine condition called adolescent idiopathic scoliosis, AIS. AIS happens when the spine curves more than 10 degrees for no known reason and typically appears between ages 10 and 18. Usually, treatments include braces or, in the worst cases, surgery. This study tried a less common approach, scoliosis-specific exercises guided by chiropractors, and followed the teens until they stopped growing completely. Who took part and how the study was done? The researchers chose 60 teens with idiopathic scoliosis who met certain rules to join. They looked at X-rays to measure how much the spine curved using the Cobb angle, a common way to measure the S-shape, and checked how mature their bones were using the Risser stage. This shows how much grown up the bones are. They followed each teen until they reached skeletal maturity, which means their bones had stopped growing. The results were measured and judged following official guidelines from a group called SOSORT, Society on Scoliosis, Orthopedic, and Rehabilitation Treatment. What they found. The outcomes fell into 3 categories. Curve correction. The spine curve got better. Stabilization. The curve didn't get worse. Progression. Failure. The curve got worse or patients dropped out before they were done growing. Here are the results. 51.7% of the teens had improvement, meaning their curves got better, curve correction. 38.3% had stabilization, meaning their curves stayed about the same. Only 13% were considered failures. Either their curves got worse by skeletal maturity, or they stopped the program early. For that group whose curves got better, the average improvement was about 12.75 degrees, which is a noticeable change. What this means in easier terms. Imagine a teen has a curved back and worries it might get worse. This study shows that after doing special exercises with chiropractic guidance, over half of the teens actually saw their spine curve get a bit straighter. Another good chunk, almost 4 out of 10, managed to keep their spine from getting worse. Only a few, about 1 out of 8, had their spine curve get worse or dropped out. On average, the teens who improved had about a 12.75 degree improvement in the curve. That's like nearly halving a small curve or making a moderate curve significantly better. Why this study is important. Shows promise for non-surgical help. Many scoliosis treatments use braces or surgery. This study looked at exercises instead and got positive results. Followed teens until growth stopped. That's important because scoliosis often gets worse during growth spurts. This study tracked them all the way to skeletal maturity. Follows recognized standards. The results were judged using trusted guidelines SOSORT, making the findings more reliable. A few things to keep in mind. The study involved 60 teens, which isn't a huge number. Larger studies would help confirm these results. It didn't include a comparison group that got different treatments, like braces or no treatment. That would help us understand how it works compared to other options. Some teens dropped out before finishing, and their outcomes were counted as failures. It would be better to know why they stopped. Was it the treatment, time, pain, or something else? The researchers themselves called for more studies to support and expand on these findings. Summary in one place. Between ages 10 and 18, many teens develop a spine curve called AIS. In this study, 60 teens did a chiropractic exercise program and were watched until their bones stopped growing. The results were, half of them had their curve get better. Nearly half had their curve stay the same. Only a few had their curve get worse or dropped out, about 13%. Teens who improved had about a 12.75 degree correction. This study suggests that scoliosis can sometimes improve or stay stable with exercises alone, without surgery or braces. But we still need more studies to confirm how well this method works compared to the usual treatments.